Asia, actually India, followed by Indonesia and Myanmar. They have huge number of cases annually. Whereas some South American countries are also declared as highly endemic part of the world for malaria. So it is a major public health problem in a warm climate, where it leading cause of death among children under 5 years of age and pregnant women, and even some non-immune travelers are also exposed to get malaria or immigrant. Here you can see the malaria region on world map. That tropical disease countries, tropical countries region is highly 25th of April, Day, celebrated under the World Health Organization to enhance the awareness, global awareness to each society. Okay. In 1955, World Health Organization started worldwide malaria eradication program. And for that malaria eradication, DDT, dichlorodiphényl trichloroethane, was used, though it was very effective. But as usual, 15 years later, resistance was developed to DDT program. And this DDT program, actually, Malaysia faced huge malaria cases before. But this malaria eradication program, it was adopted by Ministry of Health Malaysia, and they performed really very good. Okay. So the number of cases after Ministry of Health Malaysia adopt malaria eradication program, it was drastically controlled, drastically eradicate the malaria cases. Like before, around 181,495 cases annually was reported. After adopting this malaria eradication program, the cases dropped down to less than published recently in 2022. I provide the reference for your reading. And here you can see that these cases were gradually declining till 16, but 17 again it was increased. So the cases, and the blue color, actually it indicates the death, the blue line. The cases were decreased, but 16 at 16 minimum death were reported, but just only 2 cases. But then again it was increased to 12 cases a year, 17 and 18. So might be a new type of malaria. And somehow maybe the role, because that was increased in Malaysia. Anyhow, the cases, it is increased till 2016, but 17 and 18 somehow number was start increasing again. Different types of malaria species. 4 species were established, but another species called Knowlesi. This Knowlesi malaria species is confirmed in Malaysia first. And this is means in only specific this 1-2 countries. This species of. The problem is that this Knowlesi it is drastically increase is reported in Malaysia from 300 cases to 3,400 cases, and it was huge. And especially you can see that 16 it was low, but 17 and 18 a drastic inclining trend is observed. So it might be the reason that the death incidence is also increased in 17 and 18. So might be Knowlesi play his brutal role where people can get mati. Okay, so here you can see the Plasmodium knowlesi malaria cases, which is reported throughout the country in Malaysia. That Sabah Sarawak region is highly affected with, where cases in reached one means out of 1,000 population, it is 0.41 to 0.6, means it is increasing a lot. So Sarawak and Sabah is more specifically affected with these Knowlesi malaria. So my dear student, keep in mind that malaria has 5 species Plasmodium, means 5 type of Plasmodium. And this species actually like Plasmodium falciparum, which is highly means maximum cases are reported with falciparum. Some cases with malaria species, some cases with oval species, and this Knowlesi first time this species established in Malaysia, Sabah Sarawak forest. So Plasmodium parasite specifically associated with the female Anopheles mosquito. Yeah, a little bit the detail that Plasmodium falciparum, 50% of all malaria cases worldwide is reported with falciparum, and maximum from severe malaria are reported and associated with falciparum. Whereas Vivax Plasmodium, it contribute 43%, means after falciparum, then Vivax species which contribute cases. Oval is somehow rare, and very specific places, limited cases are reported with. But malaria, Plasmodium malaria, 7% cases are reported with malaria. Whereas Knowlesi, Plasmodium knowlesi, the 5th type of Plasmodium, species of malaria, this, but in this few years in Malaysia, where 2008, 9, 10, only 200, 300 cases were reported annually. But 17, 18, the incidence is increased to 3,400 cases annually. So that's why this Knowlesi is spreading in Malaysia, which we have to be conscious. So the life cycle of Plasmodium, actually it is divided into 2 phases, phase 1 and phase 2. Phase 1, exoerythrocyte, exoerythrocyte means outside the blood stage, mostly it occur in the liver. And phase 2, erythrocytic, where this phase of malaria attack reach to the RBC, red blood cells, means in the blood. So how infection develop or how it spread? When saliva of a mosquito, when mosquito bite human bloodstream, then this saliva will here you can see the infection that mosquito is bite healthy human. What will happen? Saliva will penetrate and this saliva will gradually reach to human liver. So my dear student, keep in mind in malaria, liver will affect. Liver will affect. So liver size might be affected. Okay. So in that situation, we have to conscious for the liver associated problem. Okay. Then after liver, where it start multiplying, the saliva reach to the liver, it will stay there for short time and start its strength. Replication will start where this the sporocyte become powerful or mature, then from liver it will come out to the blood. What will happen? A spiking temperature will occur. High grade fever will occur. And then throughout the body, due to blood infection, this can be reached to all organ. So this phase, when it reaches to blood, is called asexual cycle or merocyte, and then this blood will circulate throughout the body, called gametocytes, and then new Anopheles mosquito, new Anopheles mosquito will when come in contact to this patient, and then transmission or exchange of this sporozoite will occur. Exchange of saliva and blood sucking process will occur. So new mosquito get infected as well. And this new mosquito will fly to another person, and as this mosquito bite that person, it will spread the infection. So by this way, this infection will spread. Here, it is just for your reading purpose. Okay. Who are at risk? Young children, pregnant, non-immune pregnant, and or traveler, or even HIV infected, HIV/AIDS patient. And so all these are on, and children. All these are on risk for malaria. The sign and symptom: fever, chills, headaches, malaise, vomiting, mild diarrhea. These are symptoms when malaria is not complicated. But in addition to that, as I mentioned earlier, that this malaria malaria will affect liver. So liver enlargement might occur. And you know that if liver is affected, higher the chance that anemia will occur. Because after liver, it will go to RBC. And in RBC, when it affects, it will markedly reduce its iron and heme. So that's why hemoglobin will decrease and it will cause anemia. How we can diagnose? Now there are number of options are available other than symptoms and history. Other than history. patient sign and symptom and history. So after history, we have some rapid test, a rapid test, and then the blood sample we examine under microscope clearly means indicate that either patient is suffering from malaria species, plasmodium species exist in the blood or not. If it is there, then we will take two slide. We will examine two slide. Means two sample of blood we will take on two different slide, and we will examine under the microscope. So the microscope test we call blood film examination. Blood film examination. It can be two types, as I just mentioned, two types. One slide we will take a little bit thick blood and miss little bit tamba blood, not miss double drop of blood. Another one is just sticky blood, maybe one drop or just slightly touch. It's called thin blood film. So there are blood film examination, blood film examination. How blood film examination? Here you can see. Here you can see the slide. You can see that this glass slide, we will place patient blood on this slide. If concentrated blood drop is there, we will declare it thick blood film. Thick blood film. Comparatively, the large volume of blood we will place on the glass slide, and we will examine under microscope. So we will realize that what type of pericythemia is there and the level of parasitemia. So that's why we also use this thick blood film for diagnosis and for response to treatment. Means this thick blood film we are using for two purpose: one, diagnosis, and as well as for response to treatment. After diagnosis, if it is controlled, so it means that our given medication are effective. Second one, blood sample. Second one, blood sample. Actually, that will be thin blood film. Thin didn't mean that the glass become thin, but actually we will take very low quantity of blood spot on the glass slide. So less blood we will spot on it, and then we will again examine under microscope. It will give us information about morphology, means what type of Plasmodium falciparum is involved, which species caused this malaria. So once we confirm the species, then we will do treatment accordingly. My dear students, wake up. My dear student, keep in mind, thin blood film for morphology, thick blood film for treatment response, and of course, both blood film test we perform for diagnosis. Okay, but each have double action, means diagnosis plus morphology, diagnosis plus treatment response. I hope you got it. Okay, other than blood film, those Iraq when he was on the way back to his homeland, but due to malaria, he was passed away. Anyhow, for the first time, malaria treatment was accidentally came in people, human being knowledge that one old lady in China, one old lady in China was sick, and he was just laying under the shade of tree, and he was just cut some bark from the tree and start chewing. That chewing bark was quinine plant. And then the lady realized that her blood, her fever, her temperature, body temperature is getting down. So she was shocked and start more chewing the bark of the plant. And she restored her health. So from that day, it is quite old, means pre-era, where BC, it was accidentally recognized, and then by this way, people recognize the treatment of malaria. Currently, we have so many options, synthetic option, and at present, we are using combination drug. And that combination drug named artemisinin. And you can see the efficacy of artemisinin. It is very fast control malaria, and it is very effective. Onset of action is very fast, and it is very effective. Comparatively, side effects are low. So we can use artemisinin in severe malaria or even the resistance case as well, because artemisinin and artesunate combination is available oral and as well as in injectable. So other drug like quinine, oldest drug, chloroquine, oldest drug, we can use, they are effective, but not that much like artemisinin. Whereas with that, resistance is also developed. So that's why currently today, artesunate or artemisinin, which are combination drug, WHO, World Health Organization, highly encourage to treat patients with artemisinin or artesunate combination drug to treat malaria, and the treatment is just only for 3 days. In 3 days, patient will restore his health. Artemisinin combination is comparatively safe as compared to chloroquine. You can see hypotension will occur with chloroquine, whereas sulfa combination, you can see Steven Johnson or anemia will occur. Whereas quinine, with quinine, synoconism, means psychologically it will affect. Hypoglycemia can occur, hypotension and arrhythmia are the commonly reported ADRs. Whereas mefloquine, you can see bradycardia, neuropsychiatric symptoms will appear, but artemisinin is comparatively safe. And in 3 days treatment, patient restore his normal health. That's why, and artemisinin is combination of antimalarial drug. That's the reason that it is more effective and less resistance is reported. Then treatment option, the treatment, as I mentioned, that depends on Plasmodium species. But Plasmodium falciparum contribute 50% cases of malaria. So Plasmodium falciparum are 2 types, complicated and uncomplicated. As its term indicated, uncomplicated means malaria fever is reported and treatment is start faster. Whereas complicated malaria, Plasmodium falciparum malaria, and complicated when organ damage is involved, some organ involvement is occur. Then we will declare it Plasmodium falciparum complicated case. In complicated, more injectable treatment going on, and for a little bit longer duration, like 2 weeks time. Okay. Uncomplicated, artemisinin combination drug for 3 days. That's it. I hope you got it. My dear student, then Plasmodium vivax and oval, I mean, types of injectable. And Nolesi treatment is same, but little bit longer according to the guideline. So for uncomplicated, uncom day 3, 4 tablet and 4 tablet. So for 3 days treatment, patient will restore his health. But yes, in pregnancy, artemether might not be safe. But now latest article literature said that means pregnancy first trimester is might not be suitable to take artemether on means artemether combination. But late stage, no problem. Anyhow, earlier it was not indicated during pregnancy. So during pregnancy, preferably it is recommended with quinine, 10 milligram per kg, along with clindamycin. And clindamycin was recommended for 7 days. So it is considered as alternate to artemether and ephedrine combination, that for during pregnancy, quinine plus clindamycin is the good option. What happened in complicated case? Plasmodium falciparum complicated case. In complicated, any severe or complicated condition, organ involvement like prostration, impaired consciousness, respiratory distress, multiple convulsions, pulmonary edema, abnormal bleeding, jaundice, shock, hemoglobinuria, etc., is reported with when involved with the other symptoms. So it means patient is suffering with plasmodium, complicated malaria. In complicated malaria, like quinine, 7 milligram was per kg, injectable is recommended. 100 ml normal saline in 1 hour. Then dextrose 5% with cover with 4 hours, and then subsequent injectable we will continue along with doxycycline. But my dear students, now artemisinin injectable are also available, and that was combination of antibiotic. Now, so antimalarial drug along with antibiotic is also a recommended option, but in majority of condition, it is recommended as quinine. Whereas in pregnancy, as mentioned before, quinine with clindamycin is a recommended option, even though in complicated Plasmodium falciparum and pregnancy both have same option. So intravenous artesunate, the latest trial, the clinical trials indicated that artesunate is injectable form of malaria drug combination of malaria drug. So intravenous artesunate is shown to be superior to quinine therapy for the treatment of severe malaria in Southeast Asia. And according to that clinical trial, it was indicated that the mortality was noted 34% lower than the treatment given with quinine. So artesunate is superior. That's why in terms of mortality. So that's why injectable artesunate is also a preferable choice. Vivex and oral chloroquine was indicated 6 hours, and then means 10 milligram per kg, like maximum 600 milligram. Then subsequent days, 300 milligram daily is recommended, but chloroquine along with primaquine combination, it is recommended for Vivex and Ovel, but the duration of treatment is somehow a little bit longer, maybe for 2 weeks. Whereas malaria, chloroquine, injectable or oral can be given to for 3 days. But we can use some prophylactic antimalarial drug. We also can use for prophylaxis to avoid or to save patient from malarial infection. And mefloquine is one of the options which we can give once weekly tablet. Majority of time when people travel to those areas where malaria is endemic, then they will use mefloquine 2 weeks before and 2 weeks after the traveling, and the same weekly 1 tablet as long traveler is stay in that endemic area. And also means doxycycline is recommended, but for short period of time, not longer. The immunization is not that much established, but though effectively working is going on. But last time the trial was not succeeded. So again, work is going on. The side effect of antimalaria, the earlier slides we mentioned that it increased QT interval, but artesunate and lumefantrine is a comparatively low incidence as compared to chloroquine and quinine. So that's why little bit pregnancy, children, and QT interval means people are affecting. We have to be conscious. Though artesunate and lumefantrine combination, it is still very effective. Some prevention educational parameters are very important. Have the summary just for your reading purpose. Now the case study. Yes, Jenny, a 30 years old female, traveled to Colombia, and she forget to take malaria chemoprophylaxis drug. After Colombia visit, when she back, she got some clinical sign and symptom. Clinical sign and symptom, then patient history is important. Did you travel somewhere? Colombia. Colombia is a place where malaria is endemic. So higher the chance that with these clinical symptoms, patient get malaria. So doctor will perform malaria test. But for malaria test, we need to know what kind of parasite. Of course, based on clinical symptom and history, we don't know that what species involved. Patient is complicated or not complicated. So that's why let's go for the laboratory test to confirm patient condition. But keep in mind the treatment initiation must be focused that what kind of parasites involved, patient is complicated, non-complicated, children, pregnant, drug addicted persons, patient body weight. These are the important parameters or factors which we need to consider before initiation the anti-malarial treatment. So when test was performed, it was falciparum. Plasmodium falciparum, uncomplicated. Patient is not pregnant. Then artemether, remet, artemether and lumpectomy combination is perfect treatment for this patient. How? 4-tablet state, then with 8 hours interval, again 4-tablet. Day first. Day second, 4-tablet morning, 4-tablet evening. Day third, same. So total 24 tablet in 3 days. Patient will restore her health. So here, little bit just for your reading purpose, case study number 2. I put it there, but I placed answer as well. All the answer are given. You can read by yourself. My dear student, if you have any question, you may ask.
Doctor, I have a question.
Yes, please.
Do we have to remember all the specific dosages for each?
No. Just artemether and lumpectomy combination is perfect. Okay.
Okay, doctor. Thank you.
Yes. So the important thing that what kind of like here some important yes, these are the important factor you have to understand, because treatment will be based on this information. And then artemether and lumpectomy is the best treatment. Okay. Yes, artesunate treatment, injectable artesunate is available, oral is available, artemether and lumpectomy combination. Now that is oral tablet, so we can use. Yes, my dear student, if you have any question, chapat la. Class rep? Class rep, Mati?
Yes, everything good.
Okay. Okay, so should we go for our next lecture?
Yes.
Anyhow, if you have any confusion or something, then do let me know. I will repeat, no problem, or I will explain to you guys, no problem. The next lecture, actually, we have short time, but I put some slides to make your life easy. And the important thing that this topic, antihelminthic therapy. What does it mean? Helminths. How much it is important and how much population is affected with. You can see that when helminths infect a person, it will lead to a disease. And 24% of global population are infected with helminths. 24%. So this is quite common medical condition which human being means associated or borrow with themselves. So what is helminth? Helminth is a parasitic worm that can infect human and other animals. Human and animals. Class rep, human and animals. Faham? Class rep. Okay, la response faster, quicker. Okay. So earlier the problem is that human body can't recognize its sign and symptom, but gradually when it becomes severe, then only we recognize. Majority of condition, it will affect human intestine. So that's why this infection known as helminthiasis, although it's sometimes called helminthosis or simply worm infection. So in worm infection, helminthosis, helminthiasis, all these are symptoms which we are using for this parasitic worm, which can cause infection. At early stage, actually, we cannot recognize it. But later on, when it becomes severe, then symptom will appear. But how it can occur? When people walk on soil, means without any proper shoes or dress or cover up the body, what will happen? When they walk on the soil, these mm, elements will come in contact with skin, and sometime it will, if infection is cut, wound are there, then higher the chance to easily penetrate. Sometime we feel some itching on foot or something, it will start penetration into the skin, and then it will move towards the intestine. Sometimes it reaches through mouth, or majority of condition with unhygiene condition, unhygiene body situation. So means it will reach to the it will occur into the human, and dirty hand food, it is the major source. So in case of hookworm, the parasite mature in the soil and is passed when a person walk over the soil with bare feet. So it will enter into the skin, and then travel move towards intestine. Though it can be in different area. Even eyesight, it can reach to eye as well. On YouTube, you will find very amazing and means video that how it can reach to the eye. Eye can be affected with now worms. Anyhow, at early stage there is no symptom. However, the infection becomes severe. Then only we will recognize the sign and symptoms. And when it establishes the condition, it can cause physical and cognitive problems if we didn't treat accordingly. So there are some symptoms like abdominal pain, diarrhea, nausea, vomiting, gas or bloating, dysentery, rash or itching around the rectum or vulva, stomach pain or tenderness, feeling tiredness. These are common symptoms which are associated with ailment. My dear student, there are three types of ailments which can affect human. The fourth one actually is more associated with animals, but in rare case, in few cases, human is also reported with it. But that is very means rare. It is not common in human, and it is especially associated with food. So the three types, my dear student, you have to understand roundworm, number one, which we call nematodes. And these helminths, roundworm, have the scientific name. Nematodes have a cylindrical body similar to earthworm. They can lead to infect the intestine and even any other organ as well. So roundworms. Number two, fluids, which we call trematodes. And this kind of helminths, means trematodes, have a flat body and leaf shape ahead with a circle that help them attach with the stomach or intestine or any other. but thanks God, it is more reported with animal, not with human. In human, very limited, but it is little bit more severe situation will occur. Anyhow, so keep in mind that in helminth escheriasis, which is most common type of helminthiasis in human, and it caused by a roundworm, Escherichia lubricoides, Escherichia larva, and adult worms live in the intestine. This Escherichia or roundworm, it is mostly means live in the intestine area, perhaps more comply for their food. So that's why they are staying in the intestine area. Again, early stage, there are no symptoms, but as it become increase their growth and become more powerful, more in strength, number in roundworm, then gradually they will start by spreading. Initially, they will stay in the intestine, but gradually it will spread to other organ. With whipworm at infection caused by type of roundworm, it is a roundworm. Escherichia roundworm. Whipworm, it is caused by type of infection, kind of roundworm, where it is bigger infection than Escherichia. Whereas in the symptom, painful bowel movements, diarrhea, contain blood or mucus, and even frequent defecations, and even sometime anal prolapse will occur. Anemia will occur with whipworm. And then it can, again, once it grow, then it can be moved in the body here and there. Whereas hookworm infection, actually, it is in Cyclostoma duodenale and Nectar americanus. These worm infect the small intestine, but it is not like other helminth or infection that pass by ingesting eggs. Hookworm and most often contacted by walking barefoot on contaminated soil. So once hookworm enter into the foot, then it will start moving. It will cause itchiness on the skin and rash sometime, but then it will penetrate and try to go to the intestine area. So how we can diagnose helminths? Along with sign and symptom, stool test, most preferably early morning stool test. Small amount of stool will take and examine under microscope. Sometime it's species, larva, or egg will clearly indicate that person is suffering. So stool test, and preferably morning stool, small sample, will examine under microscope, and it will confirm that person is suffering with helminths or not. One thing else, the patient history, like some area where hygiene situation is not good and person is stay there, again, they are higher the chance that they will suffering with helminths, and especially the drinking water. The treatment is easy, but at least you need to understand the parasite, what kind of parasite cause infection. Currently available medicine like albendazole, mebendazole, ivermectin, these are quite commonly available. In albendazole, mebendazole, they have different chewable tablet even. And the duration of treatment, single day, 1 day, 2-3 days treatment is more than sufficient due to effective medication. So the drug affect body growth, sometimes can cause other complications. But new research indicated that it might not affect the body growth. But again, the symptoms appear. We have to treat them. Otherwise, gradually it can cause further problem. So that's why the all anthelmintics drug are of two types: vermifuges and or vermicides. Vermifuges is it expel from the body, and vermicides when it kill, the medicine which kill, and then in feces it will wash out from the body. So for that very reason, helminths, like in previous slide, we just discussed that there are three types: cestode, nematode, and trematodes. These are quite commonly affected in. So the helminths have comparatively complex cellular structure. So for that reason, it is important to identify that what kind of worm caused the infection. So the treatment will be more better and easy. And is it parasite ova or larva in the feces, urine, blood, sputum, or tissue, whatsoever the sample will specify that what type of. Then for those three types of nematode, nematodes, and cestodes, the then mebendazole, here I put some detail, little bit how it affect. Mebendazole currently it produces 100% cure rate in egg count, in roundworm, hookworm, even interobase and trichosis infestation. But in Nana, it is insensitivity is reported with currently. Mebendazole, it is largely we are using mebendazole and albendazole because majority of condition it can come. Pharmacology, I put it here just for your understanding or reading purpose. The drug for mebendazole for roundworm like Ascaris lumbricoides, 100 milligram BD for 3 days. For hookworm, mebendazole, it is 100 milligram BD 3 days. But threadworms, it is mebendazole is recommended for 2 to 3 weeks. But whipworm just for 3 days, same dose. Like roundworm, hookworm, whipworm, these are quite common and same dose. 100 milligram BD for 3 days. But threadworm, yes, the treatment of mebendazole is somehow 2 to 3 weeks. Actually, once confirm the diagnosis, then only we will go for longer period of treatment. But if mebendazole means the for whipworm, for whipworm and dog tapeworm, in that condition, we will consider mebendazole as alternate option, not as a drug of choice. Like in roundworm, hookworm, threadworm, whipworm, we can consider mebendazole as drug of choice. Whereas albendazole, it is in roundworm, hookworm, threadworm. We can go for 400 milligram single dose. In threadworm, hookworm, roundworm, just 400 milligram single dose in adults. But in children, 200 milligram single dose. So albendazole here only single dose. That's why it is in even in the whipworm, tapeworm, dog tapeworm. Again, in the whipworm, it is same 400 milligram single once a day, 400 milligram for 3 days. But with the tapeworm, then the duration is somehow longer. Whereas it considered as alternate albendazole considered as alternate choice like threadworm when strongyloids colitis is a patient is confirmed with. Same with tapeworm, filariasis, and whipworm in specific type like Trichoris triinchora. So in that situation, the albendazole and mebendazole are quite preferable option and can cover majority of condition, except means ivermectin is a little bit not covers some overall, but these 3 types have to check that what are the drug of choice. Okay, so here is just some information which I put it for your reading purpose, and some not detail is required, but I just add here for reading purpose that how pinworm or nematode, mebendazole, albendazole, and parental palmite are the highly effective single dose treatment if patient is affected with reported with pinworm, whereas it will your feelings might not be good. But this is the true and and spread in the body. So hookworm, mebendazole, albendazole are effective drug. Oral iron supplementation is given to cases where there is an iron deficiency syndrome. Majority of this hookworm is little bit dirty type of worm where means the treatment is also somehow longer and it will be suck blood and can cause iron deficiency. Another type of we call elephantiasis. Wuchereria bancrofti. This is in simple we called it elephantiasis. The leg look like elephant leg. So that's why we call it elephantiasis, and it means the treatment is also like Diethylcarbamazine is effective in killing this microfilary. Ivermectin and combination of ivermectin and albendazole are also considered an alternate option if it is taking longer time. But now these are now not that much common because is the global hygiene awareness education are improving. So a lot of these issues are controlled with. Here you can see some in the eye. In the eye, this worm affect human eyes even. And how doctor remove this from the eye. Allow. So there is some information just for gender wise how it can affect the treatment. For 100 milligram of a single dose, oral single dose, albendazole is for 100 milligram. But my dear student, again, education play very the this reinfection will control sanitation, better drinking, and improve this reinfection. Medication is only for one time, but only hygiene practices can control. Again, the case study number 2, along with the answer I provide for your reading purpose. Okay. My dear students, in summary ascariasis, whipworm, hookworm are more common. The treatment is 100% available. Albendazole, member cases indicate that this is the some clinician reports, but actually it is debatable. It is not confirmed. They said that actually it is not resistant. Some believe that it is not resistant. It is the reinfection. Some said that no, it might be resistance. So debate and research is going on, but higher the clinician believe that reinfection is more common, and the medicine albendazole, mebendazole, even ivermectin, these are very effective medicine. Still, it is very effective medicine. But in case of sensitivity or some patient, like allergic can be, patient can be allergic, but resistance is very low, only limited, but combination of drug is one of the good option. So like in elephantiasis, diethyl carbamazine along with albendazole can show good effect, or albendazole with ivermectin combination is in elephantiasis. But elephantiasis incidence is very low. Only some specific area of the world are reported, but not now. Means very exceptional cases. Majority of these three types, which we just mentioned, they are like ascariasis. These are quite commonly reported condition. So hookworm, whipworm, these kind of infections are reported where albendazole, mebendazole can show really very good effect. And here I just little bit add this 2-3 slides for your reading purpose. Means just I put this in the like appendix after my lecture. I put for your reading. It is kind of summary, and you can understand that how much it is effective actually. So this is the, I hope you got the answer that in not relapse actually. Reinfection term, reinfection is very much common because mostly patient will take the medicine, one dose of albendazole 400 milligrams, and they said, okay, perfect. But actually, hygiene practices, lifestyle modification, if we couldn't adopt, it will again, it will occur. So little bit with resistance, some clinician practitioners believe that resistance, it might be, but majority of clinicians believe that reinfection is higher. Resistance maybe. Okay. If anybody has